And we just brought you that great report by Daniel Dadze about the surgery of that young man who got his hand severed at a sawmill where he was working. And we had great work done by those medical doctors and the surgeons there. That was good work too. But more doctors, more health facilities across the country are doing great work. And already we know the second FOCOS fundraising event to support surgeries of some 100 underprivileged children is coming off Saturday, that will be next week, the 19th of May at the Mervyn Peak Ambassador Hotel. The Make a Move Save a Child project is to help children suffering from various degrees of sclerosis to receive optimal medical care and stand tall like all of us. This is possible through your kind donations, you and I, and sponsorships from not only corporate bodies but everybody else. The Foundation for Orthopedics and Complex Spine Hospital FOCOS is giving you the opportunity to save a child at its second fundraising ceremony that will be taking place here in Accra. That will be next week. And so I have some great experts as well as workers from that hospital here with us. They will be part of the whole initiative to make sure that we raise enough funding and help the hospital do its great work. Vivian Kwashikumasa is the administrative manager for the FOCOS Hospital. She's here. Vivian, good morning to you.
Good morning.
Great. And Dr. Joseph Ojedu is an orthopedic surgeon with the hospital as well. Good morning to you.
Good morning.
Doc, how are you?
I'm fine, yourself?
Yeah. I saw a surgery that was frightening.
It always.
But it comes naturally to you, doesn't it?
With time.
Yes.
With time.
You get used to.
Yeah. Can be tricky to start with here, but.
Right. But let me start off with you and as administrative manager. This is the second time you're doing this?
Yes, yes.
Okay.
We had a maiden event last year, also in May. It was very successful, and people always say that philanthropy is quite new in Ghana. However, we found out that people actually know about it, and are willing to help. So why not give them that opportunity? So we decided, okay, let's have another one.
So the whole intention is to make sure you raise enough to offset whatever costs there are or will be when you undertake free surgeries.
Yes, yes. So the surgeries that we do in FOCOS are really in the US cost so much, but down here in Ghana, we have brought it to just very low, just a very small portion. Of it is what you would have to pay. But in Ghana, when you even mention that amount, people still go like, wow. So it's hard. You have people who show that the orange seller, who has a daughter has scoliosis. $10,000 would seem like the whole world to that person. And sometimes they are unable, to raise such funds. So we really, really, crave the indulgence of the public and anybody who has some resource to help, because there are really so many children with the condition out there and they need help. Yeah.
Well, we'll come back to the initiative itself, Dr. Jedu.
Yes, please.
But sclerosis, what is it?
All right, so scoliosis basically refers to a curvature of the spine, but this curvature is in the side-to-side direction. Okay, so if you have somebody standing straight, you have a curve that goes that way. That is a scoliosis. It's different from having a kyphosis, where the curve is to the back.
It's different from kyphosis.
A kyphosis.
Kyphosis.
Yeah, so kyphosis refers to a curvature in this particular plane. So the person has what you would call a hunchback, okay, or you lose the normal curvature of the spine. But a scoliosis refers to a curvature on the side. But with most people, it's actually a combination. It is very unusual to have a pure curve in one particular plane, but then you find that it's a combination of curves. Yeah.
Well, so the idea that there are many children that suffer this, what would be the cause of this?
So on the average, about 2% of any population would suffer this type of condition. So in Ghana, with a population probably looking at about 20 to 30 million, you're probably looking at about 60,000 people with this type of thing. The exact cause in quite a number of people we don't know. Okay, we haven't been able to find out all the causes, but there are people who are born with conditions. You should understand that your backbone develops from tissues, and these tend to occur as a result of some difficulty with the formation, either because you do not divide them very well, or you divide it partly, or a part doesn't form at all. So depending upon a combination of what happens, you end up with a deformity. I try to make it simple and say, look at, you are trying to build 2 columns with blocks. Okay, so you have a column of 10 blocks, you pile them up. If the block, one column has 8 blocks instead of 10, then you find that that side is short. But because it's tied at the top and the bottom, the only way that you can get the two together is for it to curve. And that's the type of thing. So if you do not form those 2 columns, you'll be short on that side, the other side will be long, and so you have a curve that way. Or you may actually have the 10 blocks, but the 10 blocks, you have no mortar in between the blocks, so it doesn't divide, and that will give you a shortening on that side. Or you may have one column which is growing faster than the other side, and so that side will become longer and the side will become shorter. Depending upon where these deformities are, it would either give you a curve to the side or a curve to the front or the back.
So it's not witchcraft?
Unfortunately, no, it is not witchcraft.
It's the stigma that we tend to attach to it. But it means that it will cost a lot to try to straighten these, right? Or try to work on them. Usually, how much would it cost to work on a normal case? I mean, yeah, if an ordinary person will have to pay for them.
Well, in the US, you pay like over 100,000, but at FOCOS, it will cost you just between $10,000 to $15,000. Yeah.
Why is that?
Well, you know, the kind of things that I use for the surgery, you know, the implants, you know, they are made of, you know, titanium, quite expensive, and also quality care is expensive. You know, you'll be in the ICU for a while. You would, you know, sometimes even when the patients even come to the hospital, they are malnourished. You have to fatten them up. You keep them for some time, feed them well, make sure that, you know, all their levels are correct before you even take them into surgery. When you put all that together, you know, that's how come we have such. You
wanted to add something?
Yes, just to add on to what she's saying. The bottom line is that medical care is expensive and orthopedic care is expensive. Okay, afford a lot.
Medical care is expensive.
And orthopedic care is even worse, generally. But the bottom line is that some of these conditions, you see, we always see it as just a doctor treating a patient or a surgeon treating a patient. For that to happen, you need a number of people to support you who would be in the background, and you can't actually quantify how much you spend on them. So yes, for me, if I take a knife and cut you, it is painful. Okay, you wouldn't lie down for me to do that. So you need another doctor who would get rid of your pain, which is the anesthetist. You will need a nurse, you will need a scrub tech. Okay, so you need to input how much it costs to get all these people on the job. You need to find out how much it costs in the material. Okay, it is not just the screw and the rod, okay, but the other aspects of the instrumentation. It is a high-risk procedure, so you need equipment that would be able to tell you, even while the patient is asleep, that this person is safe and what you are doing is not going to cause trouble. Or even if it did cause trouble, you should be able to detect it early. All that comes in with money. She mentioned a bit about some of these children who come in with different conditions. I mean, if you have a child who has a scoliosis, invariably, if you go to your village, you find 1 or 2 of them, and they would be at the periphery. Nobody wants to even see them. That child will be malnourished. The child may come in with some other problems which has to be addressed. Some of these conditions, they are congenital, they are born with it, and if you have one, you are likely to have another one. So you have to take care of that because it complicates your outcome. Okay, so all of these add up to make your costs expensive. The bottom line, the figures that she mentioned, they are average figures. Somebody's surgery may be less, somebody's surgery may be more. Okay, and you depending upon what you do, but
okay,
you don't.
So we could have more than 15,000.
Oh yes.
As a cost.
Oh yes. I mean, if you have to take out a whole vertebral body or 3 of them, and it's a different story from putting in just a rod.
Which is easier to treat when the patient comes in younger, earlier, as a child, or is detected early?
It is much easier and less expensive to treat them when they are early. Okay, because what you do then is what we would call a guided growth. You guide them to grow normally. So you find that the person is tending to bend to one side. you actually slow down the other side and promote the side which is not growing very well. That makes it very easy. If you wait until you are picking them as an adult, when they are skeletally mature, their lungs haven't developed, their heart is already failing, then you're in trouble. So the ultimate objective of what we are doing here is to be able to detect them early. We already have started some form of screening measures. We sometimes go to schools to try and pick up some of these conditions. But yes, we want to do more of that so that we can pick
Because
them
I just wanted to ask, how do you identify the children or the parents of the children, the communities in which they are located? Because you go to some communities, even more deprived communities, and you get to find that there are people like that there. And just on hindsight, apparently they have sclerosis. So it's something that has to be detected. Somebody has to bring it to your attention.
Exactly.
Yes.
Exactly.
You know, we have a lot of NGOs that when they go out and they do outreach, you know, those who know about us, when they meet some of these children, they bring them. We have Compassion, you know, some churches, when they go out, you know, they do a lot of these outreaches in the various, you know, communities up north, you know, in the hinterlands. And then we also, you know, during the Scoliosis Awareness Month in June, we usually go out some of the schools and screen them. We have a screening program, so when we screen, we can pick up, you know, those that probably have such, you know, a tendency, and then we start, you know, giving them some, you know, treatment plan, you know, so that, you know, it does not develop into a severe case. Yes, so and then some people just walk in, you know, somebody might watch us on TV. Oh, these people can, you know, help me with my condition. Then they come in, you know. Yeah.
There was this report that we did from, is it Hokwe or who? Or one of our reporters did it. I forgot his name. I think he's in senior high school. I think he went to one of those places too. I think there's one of the specialist hospitals in Kofodia that does this. I've forgotten the name. Now, when they are old, how difficult is it?
Very difficult. Very, very difficult. I clearly remember a lady who came to see us from Nigeria. This lady, actually, she's authored 2 books. Okay, she basically is she's completely crippled. She can't even feed herself. Even to lie on her back is impossible. She is always lying prone because she virtually chokes and she cannot survive. She is one of the challenging ones I've ever seen. Nothing like that. So if you're picking them up when they are late, it becomes very difficult for both the patient and the medical care provider. Yeah.
Over time, you become non-emotive. You deal with it as a case.
Well, you try to help everybody. You try to do what is possible, okay, but there are limits to what you can do. We are only human. So there are people that if you pick them up very, very late and you already are in heart failure, we're probably going to say, hey, we can't really help because there is too much.
Performing miracles. But now let's talk about the fundraising. Fundraising could be done virtually too. So if people are not there, how do they get to contribute in a way? Because I'm thinking maybe we can be doing more 50 pesos instead of having more 100,000.
Actually, that's what we are looking for, the 50 pesos.
Yeah. So how are we doing
well, that? We want everybody to contribute. There are many ways you can contribute. We have you know, our banking details that, you know, I'm sure they'll show.
Yeah, but we don't want to go to the bank. It's too tedious these days. Mobile money is easier, you know, that kind of thing.
Yes, you know, we also have, you know, a mobile money, you know, number account. Account that, you know, we can show.
Okay, so you have a mobile money account. Have you given it to our people? Not yet.
Not yet, I'm sure.
Okay.
You know, we'll have,
all right. So you have a mobile money account.
Yes.
And then you have bank details, so if somebody wants to contribute to a bank.
Yes.
Any other means by which you raise funds apart from the sitting?
Well, so as part of our gala, we'll be auctioning items. These are virtually things that people have donated. Somebody hasn't got money to give you and would prefer to give you, let's say, a shirt. So we can auction it, and people can decide this shirt is probably worth 100 cedis, but I'll pay 1,000 cedis for it. It's just to help the effort. But the idea of, I mean, what we're doing is that nothing is too little. Even if you have 10 cedis, we're welcome, because it's a collective effort that is going to make a difference.
I see. So the event itself is next week?
Yeah.
And that's the Mövenpick Ambassador Hotel.
Exactly.
How many people do you invite, or everybody's invited?
Well, we would love to have as many people as can attend. The capacity of the hall is up to about 200, but well,
So you've sent invitations out?
We've sent out invitations. We are still sending some out, and we're selling tickets. We're doing everything to try and get as many people in there as possible. Yes.
So the 19th of May, the Mövenpick Ambassador Hotel. The time will be when?
From 7 p.m. Cocktail is 6. You know, so
we'll drink. We'll have some nice
pre-event, and then 7
Why
p.m.
do we do that? We're raising fun. We're enjoying in the process. It's part of the.
No, it's
all. So you invited big people. You have to familiarize.
No, but you must always mix it. You know.
Yeah, there's certain balance. Yeah. Certain balance to it. Well, if we have all the details, we'll put it online or on the screen so that people can know the mobile money. This is how they have to contribute. And then also maybe the bank details as well. But we know that you're doing good work. How long have you been in establishment?
FOCOS has been in establishment since 1986. In our new hospital, we've been there for the past 6 years.
Yes.
Yeah, we've been there for the past 6 years. I personally have been with FOCOS for the past 4.5 years.
Yeah.
I see. All right. We wish you all the best, all of you.
Thanks
so much.
Good work. You are the miracle workers of our country. And we've had in the studio Dr. Joseph Ojeidu. He is an orthopedic surgeon with FOCOS Hospital. They're putting together a fundraising event. It will be on the 19th of May. That's next week, Saturday, at the Mövenpick Ambassador Hotel. It is from 7 p.m. Please make sure that you go there. Okwa Kriska, you know, have a checkbook. You wanna go light but give heavy.
Yeah.
And then also Vivian Kwashi Kumasa, who is the administrative manager. Is that it?
Yeah.
Okay. Big post. Oh, it's not big post.
It's a humble post.
It's a humble post. It's humble. Which church do you attend?
Action Chapel.
That's well. Anyway, we wish you all the best to all of you.